Erectile dysfunction causes a significant impact in the quality of life, and it can also lead to infertility. So erectile dysfunction shouldn't be neglected, and please seek the help of an uroandrologist at the earliest. So erectile dysfunction, there are various ways to treat it. Of course, the lifestyle changes are the first priority. Next, we advise the tablets which are similar to Viagra, which basically we prescribe sildenafil, tadalafil and so on. If tablets don't work, there are penile injections and there are vacuum erection devices. And then if nothing works, or if somebody is not able to tolerate the tablets or the injections because of the side effects, then we suggest the penile implant surgery. So I am Dr. Pramod Krishnappa, consultant uroandrologist. So I am here to give you all the information about the penile implant surgery for erectile dysfunction. So penile implants, it's not something new. It's been there since last 1973. In fact, the first scientific paper on penile implant was first published by Bradley Scott way back in 1970s. And if somebody in 1980s had erectile dysfunction, he had only two options. One is penile injection or a penile implant surgery. Only after Viagra came in 1998, only then the entire scenario in the management of erectile dysfunction changed. So let's focus on the penile implants. So broadly, there are two types of penile implants. One is a semi-rigid implant, the other is an inflatable implant. So I will tell you in detail about what these implants are. So in the semi-rigid, again, there are two subtypes. So this is the basic semi-rigid Indian penile implant, where you see there it is made up of a different medical grade silicone, and it has different various layers of silicone in this. And depending on the length of the penis, we cut the length of the penile implant at various places, and then accordingly this is put inside the corpora cavernosa of the penis. So in the penis, there are three compartments. The upper two compartments are called the corpora cavernosa, where the blood goes in, that is when a person gets an erection. And the lower compartment is called as the urethra, where the urine and the semen comes out. So when we place these penile implants, we place it in the corpora cavernosa of the penis. So basic differences, so this Indian implant and the other implants, so the difference is, so this implant maybe the axial rigidity may not be that good because there is no central core involved, but in very difficult cases, this is the safest implant. And when it comes to this, the other semi-rigid implant, so you see there is a central core, silver core inside, and the reason, what this does is it gives a good axial rigidity and it has a memory. So whereas you compare with the other silicone implant, so there is no memory when compared to this. Okay, so this has memory. So these implants have memory. So they retain, and then it is slightly easier to conceal. Okay. So, and moving on to this inflatable implant. So inflatable implant, this is a 3-piece inflatable implant from the Boston Scientific AMS 700. So this has a reservoir where the fluid is filled, and this is the pump which is placed in the scrotum, in and around the testis, and these two are the cylinder which goes into the penis. So when a person needs an erection, he has to press this pump 5 to 6 times, and then the fluid from the reservoir goes into the cylinders, and then the person gets an erection. So after the intercourse, person presses this button and holds it for 4 to 5 seconds, and then the erection comes down. So that's in brief on how to use an inflatable implant. And you may wonder that, are all these tubes gonna lie outside? Definitely not. All these tubings are completely concealed inside, and nobody can, at the look of it, nobody can say there is an implant inside. But when somebody touches or feels or touches the penis, they can make out that there is something inside. So you cannot completely hide that about the presence of the penile implant, but definitely with just the look of it, nobody can say that you have a penile implant. And penile implants are one of the long-term solutions for the erectile dysfunctions, because the tablets, some of them, they may not tolerate the tablets, they may start getting a headache, backache and so on. Some of the cardiac or the heart patients, they are not fit to take these tablets because of the side effects, and so in such cases also we do recommend a person to undergo the penile implant surgery. So the surgery as such takes around 1 hour for a semi-rigid penile implant. It takes around 2 hours for inflatable penile implant. So what is the recovery time? So the recovery, patient usually, during my fellowship in the Spain and in Chicago, we used to discharge the patient on the same day. It used to be a daycare procedure, but the scenario is slightly different among our Indian patients. So we usually keep them admitted for 1 or 2 days and then we discharge. A urinary catheter is placed during the surgery, which we usually remove on the first post-operative day. So even the penile dressing will be removed at the time of discharge. The first follow-up after discharge will be at around 2 weeks time. That is when we see whether is the wound doing well, or is there any mild infection, does it require any additional antibiotics and so on. And the next follow-up would be at 2.5 to 3 months. That is when we teach the patient on how to use this penile implant for a satisfactory sexual intercourse. Some of the patients may have concerns about how to handle these pumps in case of an inflatable penile implant. Of course, we do teach them how to use it properly and how to identify the pump and where to press the button and so on. And over a period of time, in the 1 month's time, most patients, 95%, 99% of the patients, they learn how to handle these penile implants very well. So are there any complications? Anybody traveling on the road can meet with an accident, or the flight may crash. It doesn't mean that you stop traveling or you stop flying. So every surgery, yes, theoretically can have risk, but these are quite safe surgeries and being done since many years. So one shouldn't worry too much about the penile implant surgery. The possible complications that can happen is infection, which can happen in around 1 to 2% of the patients. Any implant in the body, take it an orthopedic implant, like you meet with an accident, you have a fracture of the bone and an implant or a rod is placed in the leg or in the hand, and there is always a chance of infection. We take the utmost care during the surgery by following all the aseptic precautions, but still some may develop infections depending on their immune status. So 1 to 2% is the infection rates, and very rarely the mechanical failure of the device can happen, but that's quite rare. With all the latest advancements and the improvements that are being done since last 4-5 decades, so the current lot of penile implants are one of the robust ones that are available. There are many brands which are common, and most of them have the robust penile implants. A person can resume intercourse usually after 2 months after the surgery, and the patient satisfaction rates in most studies are above 90 to 95%, and even the partner satisfactions, that is the wife or any partner, the partner satisfactions are also significantly better, above 85%. So penile implants are safe, and it's time that if tablets, injections, none of these are working, it's no point that you sit at home, wait and then waste time. So because the relationships can break if erectile dysfunction is not treated. Hence, do not hesitate to consult the Urologist for more information about the penile implant surgery.